4:31.
Good afternoon, all. We're calling the meeting to order. It's 4:32.
Hi.
Hi, everybody. Sandra,
Hello,
mute
please, everyone mute their
mute
mics,
your
please.
phones.
Hi.
Hi. We'll hi and bye. We got to mute our phones. Okay, so tonight, first I want to say Happy New Year's to everybody. This is the first time we're zooming in for the first time of the year. I hope everybody had a good holiday, and I'm hoping that this year going forward will be better than the year past. But I'm sure that we will have some takeaways that we experienced that we can talk about what we learned from the year from 2020. So I'm not gonna keep us long with my little greetings. I have some back end stuff I'll discuss later. So tonight we have Maria Lugo from Mount Sinai. Recently, I was had the privilege of becoming a part of the advisory board with Mount Sinai. I was introduced by Henry from DC 37 to be a part of this. So I can't tell you too much about it. She's going to tell you about it and the role that the unions have played with the hospitals and stuff. So I'm going to introduce Maria Lugo. She is the Senior Outreach Program Coordinator. And she's going to tell you about the relationships with the unions, and she's going to talk about the vaccine and the virus. So Sandra and Maria, y'all can do your thing.
Thank you so much for having me and my screen. Works? Are you able to see my screen? Are you all able to see my screen? Yes? Yeah. Perfect. Okay.
Yes.
So I have a double screen, so I apologize if I'm looking like this. But as Dalvina mentioned, my name's Maria Lugo. I'm with the Selikoff Centers for Occupational Health at Mount Sinai. And we have the privilege and honor of having, Dalvina as part of our board. And I'll share a little bit as we go along, discussing how the unions play a large role in our clinic. So the Mount Sinai Selikoff Centers for Occupational Health, we're dedicated to providing care for all workers. Our main goal is prevention, and our goal is to keep all workers' health and safety in the workplace, and that's not just for injury, but it's also for occupational illness, and that includes COVID-19, and I'll discuss that as we go along. We are part of the New York State Occupational Health Network, so there are several of them within New York State. Our clinic has 2 locations. Well, we have 4 locations, but we have one located in Manhattan and in Staten Island, and then we're part of the Mid-Hudson Valley as well. So a little bit about our clinic. Our specialty is part of preventive medicine. As mentioned, we keep workers healthy and their workplaces safe. We diagnose and treat occupational injuries and diseases, including COVID-19. The employee is our patient. So they're our number one focus. We partner with unions and community-based organizations and worker centers to support workers' occupational health and needs, and establish programs specifically for unions and community-based organizations and worker centers that focus on the need of that particular worker or union group. So just to describe a little bit between the injury and illness, occupational injury, of course, is any injury related to your work. So any musculoskeletal disorders, wounds, hearing loss, anything that is an injury related to work. Occupational illness is, of course, anything that is exposure related to work. So for instance, any skin disease for those that work with chemicals, respiratory conditions, poisoning, occupational lung disease or cancers. And of course, in this falls COVID-19 for those that have unfortunately been exposed to COVID-19 in their workplace. So a little bit about what services we do provide. So we provide the medical exams. We coordinate with specialty medical services. We screen for exposures. We do disease prevention programs that are geared to different, diseases as asbestos, mold, silica. We do workplace evaluations, such as, for those that are working remotely at home and how to set up your computer, what's the best format, what's the best chair, and if you don't have that equipment, how to use what you have at home to best support you so that you don't get any musculoskeletal conditions. We do have an industrial hygienist that will do assessments within the workplace. We have social workers who provide additional benefits for those workers that, unfortunately have to apply for workers' comp and are not able to go back to work. There are additional benefits that are available for them. We do have 2 workers' comp specialists that will walk you through the workers' comp, application, the, filing the C3. We work also with the law firms like Jordan's, law firm. We work with them, and we help with that medical documentation that is needed to push your workers' comp case forward. We are also one of the clinical centers for the World Trade Center Health Program for our 9/11, responders and volunteers as well. So when we talk about COVID-19 and the workers that were exposed and continue to be exposed, because unfortunately COVID-19 is still here, it hasn't left. And so one of the things that we do is when we get a referral that comes in, we schedule the appointment and our providers will do a medical screening. They will assess the occupational exposure. They'll ask questions. Were you aware that you were around a colleague, a community member, someone that related to your work? Are you aware of the exposure? Was there an outbreak at your job? For those that, as your union, you work with parolees. So were any of these parolees sick? Were you aware of that? Because we know that they're not going to tell you if they have COVID-19, but if you can prove that you were at work and you got exposed during your work, you can file that. COVID-19 status assessment is basically when they, when the provider will determine whether you can return back to work. In some cases, some, people with COVID-19, they have the virus for 14 days and they're able to go back to work. Unfortunately, there are some that have long-term exposures. And so they may potentially need, a little bit more time to not go back to work. So our providers will provide that assessment. They will also do an assessment of accommodating recommendations for that worker. In some cases, some workers may be able to do some form of accommodations in their workplace. Some may not, but that's something that our provider will provide that assessment for. So we're huge at worker education. We do a lot of, prevention focused education, workers' comp, workers' rights, working remotely, stress management. We know during this time, and just in work in general is stressful, but during COVID-19, it became more stressful because we didn't know how to set things up. This is the new norm. Zoom is the new norm for us. So just even setting up a Zoom call can be stressful. So how to do the stress reduction. We are, as mentioned, we're part of the World Trade Center Health Program. We do presentations on World Trade Center eligibility and benefits and about the Victims' Compensation Fund. So now I'm going to talk to you a little bit about COVID-19 and give you some basic vaccine basics. I'm going to share with you a video that it's one of the Mount Sinai health doctors. Her name is Dr. Michelle Cespedes, and she's going to talk to you. She's going to discuss what is the COVID-19 vaccine exactly. Hopefully you're able to hear it. Let me know if you do. Can you hear it?
I can't hear it.
Yeah, I'm not sure why. I mean, I could hear it on my end. I just don't know how to get that set up. So basically, what I can do is I can share, Calvina, I can share with you the video and you can share it with the group. Will that work?
Yeah, or we could
Not
put
sure
it up.
how to set it up. In some
Okay.
cases, some Zooms it works and in some it
Okay.
doesn't, not sure why.
All right.
But basically what she's talking about is, you know, the difference. A lot of people will say, well, I had COVID-19 already, or I had the antibody test done and it shows that I had antibodies and I was exposed. What's the purpose of getting the vaccine? You know, the difference is that we don't know how long the antibodies are going to stay in your system. So with the vaccine, it's a prevention. It's a form of preventing from you not getting, COVID-19. We know that, unfortunately with COVID-19, the risk factors and illness and death are much higher. And with the vaccine, it will produce a natural immunity to the virus. And so, that's why it's, important for everyone to get the vaccination. COVID-19 will, the goal is to prevent the risk of severe illness if you do get, the virus. So vaccination is one measure to help stop the pandemic. It's one part of what we call the toolbox in your toolkit. So it's one measure. It's effective in preventing, COVID-19. The combination of getting vaccinated and following CDC recommendations is to protect yourself, your loved ones, and everyone else that you encounter. Of course, with CDC guidelines, it's using your mask, covering your nose and your mouth, 6 feet distance, avoiding crowds and poor ventilation, and washing your hands. Now with the eligibility criteria expanding, one of the things is, our clinic does not provide the vaccine. Unfortunately, there is some shortage of the vaccine, and we're hoping, that the government will start providing more and more, and there are more facilities that are being opened. The important thing is that, for one, if you are part of the Mount Sinai health system, you will receive some form of message, whether it's a text and email letting you know that you may be eligible for the vaccine. If you are, then you just complete a form. It's a form that you fill out online. If you're not part of the health system, then the CDC website, you can log on, and there is a form that you fill out, and they're able to let you know if you're eligible, and you can schedule your appointment there. They are making it more available for you to get the vaccine. And so, as I mentioned, one of our major goals of our clinic is prevention. So we want to make sure all workers are healthy, they're able to go to work, to do what they need to be able to provide for their families and not have any form of exposure for themselves or for their families. And so we definitely recommend for the vaccination. This is the websites that I got the information from, and I can share this this PowerPoint so for you to share with your members. So the other thing I wanted to share is that we do have a mobile app. In the mobile app, it has a lot of information about different exposures, what to do. So pertaining to, the occupation that you work in, you can click on that occupation. It'll give you a list of different injuries that you can obtain, how to prevent them. different illnesses that you can prevent due to your work. There is also information about the World Trade Center Health Program, because I know many of, this union was very active in that time. So you can find out information there as well. We do have, as I mentioned, we have 4 clinics. Manhattan is our main location, but we do have a clinic in Staten Island, Yonkers, and in Suffern, which is located in Rockland County. So this is the end of my presentation. If any of the members want additional information, you can actually reach me either at the 1-800 number, or I can share, if there's a chat, I can share my line so that you can call me directly. We're here to help you and to provide any prevention that we can. And so I just want to thank all the members, thank the union, thank Alvina for having us. And, if you have any questions, I don't know if there's time for questions, but I'm here, I'm available.
Okay, one of the questions asked was, would you happen to know what's inside? What does the, huh? One of the questions was, do you know what's in the vaccine? Would you know that?
I would not know, okay, but I can do my research. I can ask Dr. Crane, who's our medical director, and I will send that information to you. Okay, so what I forgot to remind you all, if you have any questions, refer those questions to the UnitedProbation@gmail.com, and any questions that we have, we'll pass them on to the presenters so they can answer your questions for time's sake, okay? So it's UnitedProbation@gmail.com. Maria, we thank you so much. But at some point, we're going to have Maria and her whole team come back and just do strictly a presentation with them only about their services and about the economically correct furniture and how to work from home smart and stuff like that. Now, the beautiful thing about this journey that we're about to take is our workman's comp attorney, Jordan Zingler, has a relationship with Maria Lugo and her crew at Mount Sinai, what she said. And many of you met Jordan on more than one occasion. So now Jordan is going to give us an update on the COVID vaccine and the laws and what's going on with that now.
Okay.
Hi.
Thanks. Hi. You can hear me?
Yeah, we got you.
Okay.
We can hear you.
How are you, everybody? I'm honored to be at the first Zoom meeting of the year for UPOA. For those who don't know me, my name is Jordan Ziegler. The law firm is behind me. If you're seeing it's a big mouthful, Pasternak, Tilker, Ziegler. I usually stop at my name, etc. I've been with the UPOA since Katrina's been president. We went on tour her first year, or even before her first year. And we kind of try to upgrade and ramp up the understanding of workers' comp and how it works with probation officers, maybe in a higher degree than it was before. So I'm just going to do a quick bullet point on COVID workers' comp claims. And as Maria said, my law firm has been with the Selikoff Occupational Illness Department at Mount Sinai. Has been there since, I think, 1966, and I think our law firm's been there since 1966. I only came aboard in 01 after World Trade Center, so 35 years later, and we've been around since the beginning. And I would encourage anyone who wants any of this type of treatment to absolutely use Mount Sinai. They're experts. They know what they're doing with occupational illness and COVID and all these kind of treatments and regular comp cases also. So we have a very good, close relationship with them. So anyway, so COVID. From the beginning, I was talking to Katrina and all the other unions that if you think you got exposed at work, COVID-19 exposure at work is the same as any other kind of work exposure and should be covered under workers' compensation and not under your regular health insurance. And that's the way it's kind of flowed out. But like every workers' compensation case, we have, I don't know what we're up to, 15 offices with 150 staff just doing workers' comp for a reason. It's not easy. If it was easy and you could do it all yourself, I wouldn't have all these offices and all this staff. And Selikoff wouldn't have a whole department with workers' comp. So in order to get a workers' compensation claim and benefits through workers' comp on COVID-19, you first have to start with a positive COVID test. Okay, so if you don't have a positive COVID test, there's no claim to start. There's nothing to do. So for example, if you're working very closely with somebody, or you're dealing with a probationer or a client, et cetera, and you know they have COVID-19 and you're exposed to them, but you test negative, there's nothing to do, for me anyway. Maria's on a different, whatever, but for a workers' comp claim for lawyers, I can't file a claim without a positive test. Maybe positive antibodies, but certainly without a positive test. So I need positive antibodies, positive test. Exposure in this situation doesn't count. So you have a positive test. What do you do next? Then you could contact, Katrina gets me all the time. You contact the office. The phone number for the office, I'll give it to you, is 800-692-3717. I think I might be on your website also to contact me for COVID-19. Time limits. You have 2 years from the date you test positive to file a claim. So nobody's out of time yet, because we haven't been even around for 2 years with this thing. So usually you have to give your employer notice within 30 days of an accident or an exposure. But that's pretty easy with this, because I think you're required to tell your job that you got a positive test immediately. So that should cover that situation. And then, so what are we bothering filing for? What are the benefits? Why are we even doing it? So in the short term, for the very easy cases where you're just positive and you have no symptoms and you're out of work for 10 days, 14 days, and you return to work, there's really nothing going on. You're getting paid from the job, right, Katrina, while you're out for those 2 weeks? Yeah, Jennifer's nodding yes. So you're getting paid your salary for that COVID-19. So comp is really a non-issue, to be honest with you, for that. But we're going to the next case in the worst case scenario. So the next case is, let's say you have symptoms, bad symptoms, and you're out of work for more than 2 weeks. Now, I'm sure the city is not paying you past that for any length of time. So you're entitled to workers' compensation benefits while you're out recovering from COVID-19. And the benefits are 2/3 of your gross weekly wages, tax-free, not to exceed the New York State maximum, which is now $966 a week. But in order to get $966, you got to be earning over $75,000 a year. So I know that's not a majority of this union. So do whatever the math is. You probably are in the price range. You're probably in the benefit range of $500 to $600 to $700 a week, tax-free for workers' comp if you're losing time from work from COVID-19. Then the next thing is, the ultimate problem, obviously, is if you pass away from COVID-19, what happens with your survivors? So that's where workers' comp becomes very important. So there's two types of benefits. One is if you have a surviving spouse or children under the age of 18, right? So surviving spouse, I'll do the easy one. If you have a surviving spouse, your survivor, if I can prove that you passed away from COVID-19 from work, will get workers' comp, your workers' comp, for the rest of their life. So that could be $600 a week, $700 a week, $800 a week, whatever it is on your salary, they get that for the rest of their life, technically until they get remarried, but let's just say the rest of their life. So that's huge benefit. If there is no survivor or children under the 18, so let's say you have just a child, 40-year-old son, and that's who survives you, there is a one-time $50,000 workers' comp payment to your estate. So I'd rather have that money, all of that money, whether it's lifetime for your spouse or the $50,000 to the estate, in your estate or your family's pocket, rather than the city of New York's insurance company's pocket, because that's where it's going to stay unless we make these claims. The other thing is you get up to $12,500 for funeral expenses reimbursed. So it's not a comfortable topic to discuss, but it's prevalent. My law firm has a department. Unfortunately, we take so many workers' death claims a year that we have a department just designated to workers' comp death claims. And, you know, that's how we run them. So, but in order to get the death claim benefits, you got to go all the way back to the beginning and file a workers' comp claim while you're around. So it all starts with the positive COVID-19 test. You contact Katrina or anybody on the board, or contact me directly. We will file the paperwork for you. And the easy way is for us, we were doing this pre-COVID, but we can email you or text you all the paperwork, the forms, the C3 forms, the retainer forms, all to your phone. You sign it with your finger, text it back to us, and we file the claim. You never have to come in. You never have to leave your house. You never have to leave your office. Do it from your car, do it from the street, wherever. So that makes that easy. And then the last thing I'll leave you with, and I know I sent it to Katrina, I could send it again. I've sent her so many things. I've inundated every union with so much, their heads are probably exploding, but there's something called a special durable power of attorney. It's a mouthful. Special durable power of attorney with NICERS, with the New York City Employees Retirement System. Everybody on this screen, I'm assuming all 90 of you are in NICERS unless you're retired, but if you're active, you're in NICERS. And NICERS, you can get a disability pension if you are, you know, if from COVID-19, but let's say you pass away again from COVID-19, your survivors are entitled to a benefit from NICERS. Sometimes you have to actually be alive in order to file a disability application, unless you die from an accident immediately. But if you're in the hospital and you're on a ventilator and you can't file the paperwork that you're disabled, and they're not letting your family into the hospital, you might be out of luck on a disability pension for COVID. This special durable power of attorney, which is on the website for NICERS. It's on the website for NICERS. You just click on there and find it. You fill it out and you assign somebody to be able to represent you to file a disability pension application on your behalf. You can assign, you know, anybody you want. Should also assign Katrina. I'm just kidding. She's gonna shut my Zoom down in 2 seconds. But you can assign anybody, and it's only for the limited purpose of filing a disability application through NICERS. It doesn't give the person any other powers to do anything else for you except disability pension applications with NICERS, and you can always withdraw it. So if you get into a fight with the person, or you don't want them anymore, you withdraw it and they're out. If you do a special durable power of attorney, I would give it to the person that you're assigning and keep a copy for yourself. And you file it with NICERS. And so that's all I really have. It was like a hard stop. I didn't have a soft, gentle conclusion, but those were the highlights I wanted to share with you tonight.
Jordan, one of the questions was, what about domestic partners? How do they fit in?
Oh, in the workers' comp world?
Yeah,
Yeah, they're covered.
they're covered.
Yeah.
Maria and Jordan, let me ask you a question. Because I have a lot of retirees up here, and most of the information you're telling us is more about active. Is there anything that retirees need to know about when it comes to the vaccine or COVID or the 9/11? Some of them retired, and how they can benefit from what happened before they retired, or
Well, Maria, I'll give it to you in a sec. So on the 9/11, you can have, as long as you file the notice of participation with NICERS that you participated in the World Trade Center event and you were down there in the area, you have for the rest of your life the ability to convert your service pension into a World Trade Center disability pension. So that's lifetime, but you got to file that notice of participation and have that in there.
what about if you worked in the area?
If you worked anywhere down from Canal Street down
Okay.
to the lower tip of Manhattan, that's the World Trade Center area. So if you work down there, and there's certain requirements of when you had to work there and for how long. But if you did that, you have to file, it's called a notice of participation. It's on the NICERS website. And that goes in, and then you can convert your service pension into the higher paying or tax-free World Trade Center benefit for the rest of your life. And if you file once and you lose, you can file again. You lose, you file again. We do that in-house. We file those applications for members if you want in-house, part of what the law firm does.
But we, in reference to the World Trade Center program, we help with that enrollment application. So it's a full packet that we give. And I had mentioned to Jordan that one of the questions that we do ask is if you are NICERS, if you're part of NICERS. If you are, we include that paperwork in your packet. And, I know specifically when I get those, when I have someone, in my packet, I have sticky notes and I let them know this is what you need to fill out. This is the information that you need to sign. This is where you mail it. Make sure you keep a copy for yourself. So I'm very specific so that when Jordan gets the case, hopefully everything's already outlined and there's less work for him to do, hopefully.
Okay.
But it's a team of us that we do provide assistance with the enrollment application. If you're already enrolled in the program and you have not come back for your monitoring appointment, we encourage you to continue to come. One of the things that, we do specify for, especially the retirees, once you get an illness, especially from 9/11 related, there is a cap on your insurance in most cases. So let's say, God forbid, you get cancer. There is a cap on the insurance, and what ends up happening is if you have other members of your family in your insurance coverage, then that cap, they will no longer be able to have insurance under them because you've used up all the insurance cap. So if it is a 9/11 related condition, the health program covers it 100%. So nothing out of pocket, no insurance that is needed. So then your family then can use the insurance without any issues. So that's one of the big pushes that we do. And, some members are like, well, what's the point of going to the annual health monitoring when I have my own primary care? Well, just like with COVID-19, our clinic looks at specific things that are 9/11 related. Just like COVID, there are specific things that we continually monitor. And so every year when you come in, that you do your chest x-ray and blood work, that's consistently monitored. If you do go to your primary care, continue to go to any specialist that you go to. But if you have specific conditions, when you come to your monitoring appointment, bring that with you so that then if it is a condition that is certified under 9/11, then it's covered. Medication, any equipment, anything that is needed for that condition is covered 100%. When it comes down to COVID-19, if you are in that eligibility criteria, so we have 65 and older, any comorbidities, any illnesses or conditions that you fall under that eligibility criteria, we highly recommend for you to get the vaccine. It is important. As you've noticed, more people are getting the vaccine, less people are dying from the illness. So we're starting to see that trend. And so that's the importance of it, reducing the death and reducing the risk of getting COVID, and hopefully we can have some normal, get back to some form of normalcy in our lives.
Okay.
That's
Thank
my
you.
kind of talk.
Thank you so much. So thank you so much, Jordan and Maria. We appreciate that partnership. And we look forward to working with both y'all in the future. I guess that's like a bittersweet situation, but to have you is a blessing. How about that? It's a
Thanks.
blessing. And
Thank you.
thank you so much. So now on our agenda is our attorney, Mr. Harry Greenberg. He's going to give us an update on what's going on in the world of labor. Mr. Harry, yay.
Can everybody hear me?
Yes.
So let
Everybody
me
say thumbs
begin.
up.
What?
Thumbs up.
Thumbs up, great.
Yeah.
Okay, so let me go back to 2014. Now, your neighbors that are not city workers, when they have their health insurance, they have to contribute towards the premium. The city of New York, you do not. It's in the administrative code and you don't have to pay unless you want something over and above what everybody else gets. So in 2014, we saved the city by changing, if you remember, emergency room copays and things like that. And we saved $3.4 billion. In 2018, it was another 1.6 billion. And now the city is in bad shape, and hopefully the federal government will help bail us out. But they're looking for more savings without changing your benefits. And what we're looking at now is for retirees. There are approximately 250,000 retirees over 65 that have Medicare. And some of their spouses are younger, so they have the regular insurance, while you, the older person who's 65, has the supplemental, right? So what happened is, we first started looking at drugs. We put out what's called a request for proposal. We came to an agreement. I'm not sure exactly when this is going to happen, but you will see no change, and we're going to be saving $200 million a year. Now, also, we have a group that's working on senior care. Senior care is people who are 65 and older. You have Medicare plus some other supplement. It could be Emblem, it could be GHI, it could be HIP, it could be Aetna, whatever it is. And for everybody who watches TV, you see Joe Namath on there saying, Medicare Advantage, you get more and you don't have to pay anything. In fact, you may get money back. We're looking at that now. We had 4 bids on it. I think we're going to be down next week to 2, and there's going to be a savings of estimated at $600 million a year. Now, why is that important? Without any changes to your health, without changing your doctor, without changing your hospital. That's what we're talking about now. It's not done yet. There'll be more meetings in the next couple of weeks. Having said that, if that comes about, there's a thing many of you may have heard me talk about, the Stabilization Fund. And what that is the city puts in $35 million into a fund to make sure we don't run out of money. It's like a reserve. Well, because of all the benefits that we've been giving, we're in bad shape on that. If we come to this agreement, this will help us out a lot. So if it goes the way I'm expecting it to go, and it's not finalized, you will not see any change. You may get a new insurance card, but you'll have your same doctor, your same hospital, your same everything, right? And it'll save the money and help us in the future. So that's what's going on now. It's very important. Now, if the city gets the money from the federal government, there is reported in the newspaper, Nancy Pelosi said she's thinking of $90 billion to New York. Now, I don't know if that's a real number or not, but all New York needs is about 5 or 6 billion, and we're in good shape. So we're hoping that goes through very shortly, and we'll be in good shape. If you have any questions, get them to Katrina. I'll be more, and now this is just for retirees, okay? I'll be more than happy to get you an answer. Thank you.
Thank you, Harry. I was stuck. Real quick, we have Deborah Williams from DC, who's DC 37's health and safety coordinator. I just want to give her a shout out. Deb.
Hi everyone.
Deb is
how's everything?
Yeah, I'm on the board with these wonderful ladies and gentlemen on the Mount Sinai. So, and Debbie's been guiding me through step by step like a newborn. So just wanted to say hi, Saturday, real quick.
Yes, and I just wanted to say hi, and I wanted to say thank you so much for your willingness to participate. And I'm looking forward to working together to create positive things for your members in terms of safety and health, and just getting to know how we can assist not only just your members, but their families and communities as well. So again, thank you so much for being willing to participate. and I really appreciate you.
Thank you so much. And Gail Sealy is our health and safety coordinator for the union. So somehow I'm going to pull Gail into these meetings at some time. I'll talk to Debbie and Ms. Lugo and see how Gail can help us along with this, along with the program. So next on our agenda is our EEO attorney, Erica. I'm going to give you a brief give you an update as to what's going on with the EEO case. But let me just say this before Erica goes on. The EEO case is for the whole entire membership of the department, the UPOA. We had 5 individuals who was very brave to step up to represent the whole body. It wasn't just those 5 young ladies. It's for the whole membership. And they had stories to tell, and their stories represent our stories. Because I got some emails and calls about why wasn't I in the lawsuit. You all are in the lawsuit, but Erica's going to explain to you why it's done that way. That's why they call representative plaintiffs, complainants. But I'm gonna let Erica explain that to you, but I just want to make it very clear that EEO case is for all probation officers, men, women, despite your nationality, ethnicity, all that stuff is for every last one of us, okay? So I just want to let you guys know that. And I would never do anything if it wasn't going to include everybody. Understand that. Erica, where you at?
I'm right here. Can you see me?
No? Okay, we'll find you.
Okay. Thank you. Yeah, no, thanks for making time. And that's a great starting point. But I do want to back up for a minute and just say that the last time I spoke with you all, I believe was maybe late summer at the last meeting. And at that point, we were still waiting for the EEOC to finish their work on your complaint. That's the Equal Employment Opportunity Commission. Any complaint that's going to be brought in federal court regarding any sort of discrimination is typically brought to the EEOC first. That's a preliminary step that you have to take before bringing claims under Title VII, which is the federal statute regarding discrimination. So we waited for that to be done. We waited patiently. It took a little while, but they completed their work on it. And they gave us what's called a notice of right to sue. That enabled us to prepare a complaint, as Dalvani said, and file that complaint in federal court for a class action lawsuit in early January is when we filed that. And we worked closely with the union as well as a number of people, not just the 5 representative plaintiffs, but also other folks who over the past years and the past months have provided us very helpful information. And we're going to continue leaning on you for that information. And so we filed that in early January. As I said, it's a federal class action lawsuit. As we said, it's on behalf of everyone. The claims are regarding both unequal pay and unequal types of promotions. So meaning the argument is that the city and the Department of Probation undervalues your work in general. And over time, as the demographics of the department have changed, the argument is that the value given to your work and the pay in comparison to the pay of other people has decreased and gotten to a point where it does not adequately value or compensate you for your work. We also describe in the lawsuit how the complexities of your work have only increased, the caseloads have only increased. And again, the representative plaintiffs, the stories that they tell are, again, representative of everyone's. The lawsuit is, it's an effort to recover back pay and other types of damages on behalf of everyone, including retirees. The goal is to recover as much as possible. There are some restrictions under the law. We can't necessarily recover for folks who have retired many years ago, but it's our goal to recover, include in the class and recover damages for as large a group as possible. And we're going to keep you updated about that. We just filed in early January. We then served the papers on the city and the Department of Probation. They get an opportunity now to respond and to make their arguments. We will hopefully be in front of the judge for the first time in April, we hope. But again, we'll keep you updated. Sometimes things move a little slow and then all of a sudden they'll pick up again. So sometimes we'll have lots of updates for you on happenings in the lawsuit, and sometimes we'll need to wait for the court to go through their process. But we will, of course, keep you updated on all of the ramifications that we see coming from this. And I think that's it for now. As I said, we're kind of in that place where we need to give defendants time to respond. So we're holding back for a minute and preparing for our next step. But we hope to have more information come April about what the next steps exactly will be.
Thank you, Erica. So those are our presenters for the evening. If you guys want to hang out, that's cool. If you want to catch the next bus, no, travel safely. But I just want to go into the next thing. So we was talking about the vaccines and COVID, right? So we had our attorneys make sure that we were a part of that group of first responders to be a part of that vaccine whole movement when they started moving, giving the vaccines. And I thank you for that. And so coast probation officers are now being recognized as first responders. But we found that when it first started to roll out, it was very hard for a lot of us to get the vaccine. So I reached out to the commissioner and I said to her that, and I was getting calls that people was having problems. So I reached out to the commissioner and I said to her that as a union and as a department, we have to do better to make sure that our members are getting the vaccine, those who want to get the vaccine. I did mention the retirees and they're looking into incorporating the retirees into having access to the same sites as the officers, active officers have. So I have to give the department their kudos because once that I reached out to them, they have been very diligent in keeping us updated as to where the vaccines are. We even have our own site in Staten Island. For some, it might be an inconvenience to get to, but my thing is when it comes to our life, there's no such thing as an inconvenience. So we do have our own site. I think it's at Wagner school in Wagner. I'm not sure the address, but Anna's been putting them up on the website. So I want those who are interested in getting the vaccine, which I hope many of you are, and I'm not going to push my beliefs on anybody because one topic I want to stay away from, but the opportunity is there in a lot of ways for us to get the vaccines. We have the pods where you can get the officers can have the privilege of working at the pods, acting as monitors and helping people move along in the different boroughs to get the vaccines in the community, while also being able to get the vaccine yourself and earning some nice overtime, a good 12 hours for every time that you work at the pod. So that's a good thing. So the department is definitely working with us on that. And I just want to acknowledge that. We are still working on the benefits booklet. It's going to take a while. I don't want to say when. I'm hoping to have it done by Charlene, what you think, by June? She's like, I don't know. It's a lot of work for us to do. We want to make things much more clear to you all when you look in the books. Like I said before, we're going to have one for the retirees and one for the active, but we're working on the active first because that'll take the lead out for the retirees booklet. We decided not to do a massive mailing right now because of economic reasons, but once everything starts to once the finances are in a better place, because now we have that deferment. So I don't want to do a big purchase of doing a big mailing and having the books made up when we have to preserve our money, which we're still in a very good place all the way to December and beyond. But what we're going to do is once the booklet is made up, Tandra's going to work with the young lady who's working on the booklet to put the information up on the website, and that you can look at, you'll be able to see it from there. I know many people do not have access to the website, but you can always call Charlene or Joanne or myself and ask us any questions about, what you're entitled to. So that's still in the making. And we're going to make it very friendly, user friendly, and we're going to make it very interactive, thinking of ways to make it more interactive. With that said, while we was reviewing the booklet, we noticed that we had a benefit that called the prosthetic. The prosthetic in the booklet was for a limb, which is for a leg, I guess, or an arm. If you lose an arm or a leg, I don't know how many. We only had one officer that I knew that had a prosthetic. But anyway, we decided to do. The trustees decided to do is to expand that benefit. It's up to $2,500. A prosthetic also includes the wig for those who need it for cancer. So we're going to include in that prosthetic benefit to cover the limbs, the breast cancer wig, and the pads for the bras or anything pertaining to that's defined as a prosthetic. So unfortunately, but yet fortunately, if we have any members and retirees, Charlene, right? Right, it's for the spouse and how does it go again?
Yes, so it's member, well, no, right now it's member spouse, where are we
Right.
doing member, spouse, and
Right
dependents?
now, it's just member and spouse.
Yeah,
And then down the road, we'll look to cover the dependents. But for now, if you have a spouse or the member that unfortunately needs it, you can use that benefit. And if you need more information about it, Charlene can tell you about that too. So that's that. And oh, right now we're doing on-site testing, and I'm not saying I agree with it, but I'm not going to fight the department for doing it. I think it's a good idea. Our attorneys know about it, so it's not like it's a secret. So the first site that's doing the on-site testing is at the 198 Neon, and that's the only place right now where we're able to keep the members separate from the public because the way it's designed, and it's open to active and retiree members it's in the Bronx, who wants to go and get tested for the COVID. You don't have to wait online. All you gotta do is show your ID. If you don't have a job ID, I have been sending retirees the PBA card, so that you can even use a PBA card to go get tested. I don't know how they're gonna do it later on. It's supposed to be just temporary, but for now, it's the on-site testing. We're looking to eventually do on-site vaccines. I don't know how that's going to work either, but we're looking to try to make it as accommodating as possible to get as many people vaccinated as possible. Right now, when the accommodations we have in Staten Island, and I think other places, you can now take your family members with you to go get, who are eligible to go get vaccinated, which is a good thing too. I haven't heard anything about kids. I don't know anything, they say anything about kids, Ms. Lugo, so I can't speak to that yet. But I believe that as a child is 18 and up, they can probably get the Moderna, but I think they have to also meet the requirements. So I don't want to speak too much about that. The Black in History, Black in History Caucus is coming up, and I have been invited to come and speak on the panel about the great works that probation officers do in keeping people from recidivating and getting rearrested and reducing mass incarceration and juvenile detentions and stuff. So I think, Jeff, you posted it on the latest news.
Yes.
Okay, so it went out, and anybody want to get into join the link, it's $20. And I don't gain nothing from it. It's just a $20 fee to register because there's other panels that's going to be talking for that day too. And good thing about it, you don't have to travel up to go to the Black and Hispanic Caucus this year. You can actually participate from where you're at. The PBA cards are not ready yet. I'm hoping that they'll be able to be picked up this week. And any other distributions that you guys are looking for will also, I'm hoping will be ready this week. Anything that you need as far as the other distributions, I ask that you reach out to your executive board and give them the requested documents, because I'm not going around to borough to borough. This is for the active. And I will not be going around to borough, and they're going to be coming to me to bring me what I need to get you what you need. As far as anything else, refer to the United Probation at gmail.com for any questions. Also remember, when you put your claims in, active and retired, please submit your claim forms, because when we get audited, the auditors look at all that stuff, all that has to be attached. When you upload your claim too, you have to upload the claims into your ASO folder. You have to put the claim form with it. So I see a lot of retirees are here tonight, and I want to thank you all for joining us tonight. I want to thank all the active that showed up, and hopefully, I can't tell you when, but maybe next year this time we'll be in a better place. I think that's a safe answer. So Mr. Simpkin wants to say something before we close out. Yes, Lou, unmute yourself, Mr. Unmute, push the thing. You're not unmuted. Where's your wife? Get your wife. Go get your wife. Tell her unmute. He's getting his wife. I think that's it. Anybody else? Chandra, Joanne?
Cars.
Say something to your retirees? Yeah. Joanne?
Trina,
Yes.
you wanted to do the cars.
Oh yeah, one more thing. So I received an email from one of our colleagues about the cars, and it was, and this is one of the cars, and it was a concern, a valid concern, but it wasn't about. I don't see this being a departmental issue. Now, to my knowledge, the department gives you the wipes and stuff to keep the cars clean. But this here that I'm showing you, that Tam just trying to show us, it's not a departmental issue. And the reason I'm doing this is because I remember going in the field myself, and I have seen cars look like this, and there's no reason for it. If we want the department I'm trying to get us better cars down the road. I'm trying to get us SUVs. But if we can't, and I can't promise you that neither, because if it's up to the city, they would get rid of the cars. But the point is that this here is not cool. And whether, I don't care what borough it's in, if we are using these cars, you wouldn't treat your own personal cars this way. And I'm saying out of respect for each other, not to treat the department cars this way, because your brothers and sisters have to get in these cars. And if you got, and that's a McDonald's napkin. I know a McDonald's napkin from anywhere. If you're eating in the cars and you take your garbage with you, you know, and just, well, I'm just saying, I was very, I'm upset to see this because you are all professionals. And I think that we need to keep everything that we work in, whether it's the cars or your office space, you need to try to keep it more, Tam, you can take it down, more clean. You know, that doesn't make sense. I remember one time when I was going in the field, a doorknob came off in my hand. That's another story. But I'm just saying, going forward, let's respect the vehicles, the little bit of vehicles that we do have, and try to maintain them. That's not the department's responsibility to take your garbage out of the car. Now, if you don't have the wipes and the necessary tools to keep the car clean, then let me know about it. And I did, and going back to the COVID, I did ask the question about what happens if somebody shows up positive and they use the car. And I did ask Michael that. So far, from my understanding, those who did show up positive had no access to the cars. And I think a lot of y'all are now using your own personal cars anyway, which is another subject that, whatever. So Lou wants to say something before we go.
Am I okay now?
Yes, we can hear you, Mr. Sim.
Okay. First of all, I want to thank you and the other members of the executive board of the union for inviting me. I find it very stimulating, and I enjoy the ability to keep my hand in and find out what the heck is going on. So again, thank you. I want to say that while I have nothing but fine things to say about the union, the welfare fund, and the people who are involved in the welfare fund, they've always been very helpful to me. And the only problem is the experience I've had with the city of New York is virtually opposite that. I don't know, I sometimes thought I was being paranoid in thinking that the city of New York treats some of us who are retirees living out of the state of New York as stepchildren. I mean, I especially want to point out that the treatment that I received recently regarding the open period to the benefit of being able to change health plans, at least for retirees, was a horrendous experience for me. And I'd like you all to know about it, and perhaps you can do something about it for the future. When I say treated like stepchildren, the first inkling or official notice I received that there's an open period sponsored by the city of New York for its employees and retirees was a letter I received in my name from one of the health programs telling me that they have now contracted with the city of New York. I forgot the name of the program. Atlas, was that one? Anyway, I was horrified because I should hear the first official information from the city of New York. They're the sponsoring agency for this purpose. So it's kind of shameful that the first time I should hear about what is available comes from one of the contracted providers, okay? Finally, I was in a position where I didn't receive anything by email or by postal service. And at the last minute, it was now close to the end of November. I had to hustle around and call people to try to get information, official information. The upshot of this whole thing was that I was playing catch up. I didn't know what was available, what other choices are out there, and I had to do it on the fly and in a hurry, so that I did change plans. I now have Medicare Advantage under Humana, and the card I received said January 7th because it was too late. And they were kind enough to include me in the year beginning January 1st. But the awkward situation was, and this is a horror, it's a nightmare. I had an appointment to go to a doctor in the first week in January. And it was an awkward situation because do I tell the doctor I have a new plan, but I don't have any paperwork to confirm that? Or am I still included in the old plan, which possibly could have already dropped me? So it's an awkward situation. And I'm glad to see that you guys are very active and your hearts are in the right place and you're trying to do the best you can for the membership and also the retirees. One thing I want to say, which is points up something that was my own fault, which is that when I retired to Florida, I knew at that time we didn't have any network dentists in Florida. So for all those years, I paid my own money, and then I put in a form to the welfare fund to be reimbursed based on the schedule if you go to your own provider. I didn't realize until after you guys got self-insured dental services, or AOS, is it? That you now have network dentists. That's a beautiful thing. So my wife and I made appointments with one of 3 network dentists down here in Delray Beach, where I reside in Florida. And it's just my own fault that I didn't take that opportunity when you first contracted with ASO.
Okay, so I got to wrap it up for tonight. Thank you so much. We always like to let him give input because he used to be a union rep like the rest of us. So I'm going to wrap it up. Joanne, you want to say goodnight to your retirees? And you fine? All right, so I'm going to wrap it up for tonight. Kathy, you on?
Yes, I'm on.
All right, so you can call it.
All right, time now is 5:34. Meeting shall come to an end. All those in favor?
All in favor? Aye. None opposed. Everybody get home safely. Don't talk to strangers. And I'll talk to you later. Good night.
All right.